Chapter 15, the Hematologic System. Chapter Objectives. Clinical objectives. The blood has various functions. It transports all the water, nutrients, and medications to the cells throughout the body. It also assists in transporting oxygen and carbon dioxide. It does help regulate fluids and pH as well as acid balance. The blood also helps regulate body temperature, and it helps provide the factors that are needed for clotting. Blood is composed of formed elements as well as plasma. Your formed elements are your cells, so red blood cells and white cells as well as platelets. The plasma is made up of proteins, mainly water, and gases. In a vial of blood, if it sits long enough, the solids will go to the bottom, which are your cells, and then the liquids or the plasma will be on the top. Plasma proteins have various necessities throughout the body. One plasma protein is albumin. It raises the osmotic pressure, prevents fluids from leaking into tissue spaces. We also have alpha and beta globulins. These carry drugs and lipids and transports them throughout the body. And then we have fibrinogen that is needed for clotting. Blood cells actually come from the stem cells, which are made in the bone marrow. The kidney makes a lot of the body's erythropoietin. This actually determines the erythrocyte production by the bone marrow. For erythropoiesis, our bodies require iron, B12, vitamin C and E, folic acid, and some amino acids. Red blood cells, they contain hemoglobin that carries the oxygen to our cells and carries carbon dioxide away from the cell. We all have, as an individual, have our own hereditary blood type. It's based on the antigens that is attached to the red blood cells. A red blood cell will live for approximately 120 days. The normal range of red blood cells for an adult is 4.2 to 6.2 million cells, and it varies by gender. For hemoglobin, the normal range is 12 to 18 grams per deciliter. This also varies by gender. If we have a decrease in the number of red blood cells or a decrease in the hemoglobin, this will result in a reduction in the amount of oxygen that is able to be carried to the bodies of each cell. All cells need oxygen for survival. White blood cells, these are one of our first lines of defense to assist our body if there's a pathogen, an antigen or a pathogen that comes into our system. The white cells, the normal value that is known is either 4,500 to 11,000 or 5,000 to 10,000. It depends on the institution. White cells are divided into different types of cells. So granulocytes are divided into neutrophils, eosinophils, and basophils. These are all produced in the bone marrow. Neutrophils make up 54 to 62% of the white blood cells, and these actually will engulf and destroy bacteria through the process known as phagocytosis, which is consuming or swallowing other cells or particles. When an infection starts in the body, this will stimulate an increase in the production of neutrophils. This will cause a white blood cell count to increase, and this is known as leukocytosis. Eosinophils, they make up a small portion of the white blood cells. They actually increase during allergic reactions and in response to parasite infections. Basophils will release histamine when there is an allergen present, and it will help prevent clotting in small blood vessels. Agranulocytes are lymphocytes and monocytes. These are produced in the bone marrow and in the lymphatic tissue. Lymphocytes are roughly a quarter of the white blood cells. Lymphocytes will either be B cells or T cells. B lymphocytes will transfer into plasma cells to produce the immunoglobulins that are responsible for the humoral immune response. Some T cells are killer cells. These will fight antigens and provide a cell-mediated immune response. Monocytes make up a small portion of the white blood cells. These become macrophages, and these migrate into tissues. Then they become the phagocytes. They help fight infection and rid the body of foreign materials. These phagocytes engulf bacteria and any foreign substances to help eliminate them from the body. A red blood cell count, an RBC with a differential, will provide information about the numbers of the different types of leukocytes that are present in the blood, and also about the type of inflammatory process that may be occurring. Platelets are necessary to promote clotting within our system. This is due to fibrin strands that are derived from the fibrinogen in our blood. The normal lab platelet count can range for adults from 150,000 to 400,000. Platelets will live for about 10 days. These will clump together, and they can either they can cause a clot or assist the body to clot off a bleeding area. The lymphatic system consists of lymph nodes, lymph channels, the spleen, as well as the thymus gland. The spleen is in the upper left abdominal cavity, right below the diaphragm. This filters blood, removes pathogens, old blood cells, and produces lymphocytes. The spleen is a reservoir for extra blood. In response to hemorrhaging, the spleen will contract, and by contraction, the spleen will release some of its stored blood into the cardiovascular system. If the spleen would be removed, the function is taken over by the liver and other lymph tissue. With age comes multitude of changes in the body. There is less antibody response to foreign proteins. There's also a decreased secretion of the intrinsic factor in the stomach and a decreased absorption of vitamin D12. This will maybe lead to pernicious anemia from a vitamin B12 deficiency. We also have pigment loss and a yellowish cast to the skin that are common changes. These routine skin changes make pallor and jaundice often more difficult to determine in an older adult. An older adult is admitted after a recent fall. Which clinical finding would be associated with the aging process? Decreased hematocrit, decreased red blood cells, a prolonged time, increased neutrophils, increased platelets. The correct answer is number 1 and 2. An accidental tearing or cutting of the vessels of the cardiovascular system in surgery could cause bleeding and a loss of blood. A blunt force trauma to the spleen that might occur during an accident may cause a tearing and massive internal hemorrhage. Other causes of disorders can be due to genetic disorders like sickle cell or hemophilia, hemorrhage that will cause anemia from blood loss. Anemia can be due to iron deficiency or folic acid deficiency, as well as chronic slow blood loss. Hemolysis can be due to a blood transfusion reaction. Bone marrow suppression is due to any type of anti-neoplastic agent or irradiation. And bone marrow proliferation or abnormality can be due to leukemia. There are genetic tendencies that can cause different types of hematologic disease processes, sickle cell disease, pernicious anemia, and thalassemia, as well as leukemia. These can all be caused by different genetic disorders. As a nurse, we help prevent blood loss through hemorrhage. We know that bleeding from menstruation can cause a disorder. So we, as nurses, try to help prevent hemorrhage after surgery or childbirth. We will make sure that we assess blood loss, and we will provide methods to stop the loss if it is excessive. To help the public prevent blood disorders, nurses will often provide education. So we can discuss about being near radiation and harmful chemicals, suggest some genetic type counseling if the individuals have a genetic disorder. We can talk to our patients about medications and tell them the signs and symptoms for excessive bruising or easy bleeding. And we will also educate them on having their blood count checked periodically. Severe bleeding can lead to irreversible hemovolemic shock and circulatory collapse from the loss of intravascular fluid. Blood loss from an artery is bright red and will gush forth, spurting at irregular intervals with each heart contraction. The blood from a severed or a punctured vein will leak slowly, and it'll be steady, and it is a dark red in color. Patients that have some disorders like polycythemia vera and patients that have high platelet counts are at risk for increased clotting. We want to tell our patients to help decrease their fatigue by spacing their activities throughout the day and making sure they have frequent rest periods. Stamina for them will improve as their red blood cell count and their hemoglobin rise. Small, frequent meals that are high in protein and vitamin C as well as iron should be eaten unless told otherwise by the physician. Sometimes providing mouth care before each meal can make the meal more palatable. If we have a patient that is experiencing pain, we want to make sure that we assess their pain level every 4 hours and medicate as ordered by the provider. If a patient is moderately to severely anemic, the oxygen carrying capacity of the blood is diminished, so that there will be less than optimal perfusion, and tissue hypoxia will make it easier for pathogens to invade and cause infection. When white blood cells are decreased or abnormal, there are fewer cells to fight infection. Patients that have such abnormalities of the blood need to be taught how to protect themselves. Bone marrow failure will occur from abnormal cells overcrowding the normal cells or from an inadequate production of normal cells. Leukemia will cause an overproliferation of abnormal cells in the bone marrow. Chemotherapy, radiation, thrombocytopenic purpura, and chemical toxicity can be factors in bone marrow failure. As a nurse, we need to make sure that we understand and know these specific lab values. Hemoglobin varies by gender. A good way to remember a hemoglobin value is between 12 to 18. Red blood cell count also varies, so it should be somewhere between 4.2 million to 6 million red blood cells. Hematocrit also varies depending on the gender. White blood cell count should be somewhere between 5,000 to 10,000. The thrombocytes, or the platelets, need to be 150 to 400,000. Our APTT needs to be 20 to 25 seconds. The PT needs to be 12 to 14 seconds. And the INR for anyone that doesn't have a bleeding disorder is 1 to 2.